I know in an ideal world, everywhere would have dental x-rays. I think we're still a little bit further behind in terms of every general practice having it yet. But say, for example, I locum somewhere where they don't have dental x-rays. So quite often I've looked at a dog's mouth and thought, oh God, there's so much tartar. I bet there's loads of gum recession, some of those teeth, there's furcation exposure, blah, blah, blah. But I'm not going to know until I get in there. I mean, I had one even the other day where it's anaesthetised, I've cleaned all the teeth up. And I've thought, okay, there's a lot of gum recession, there's furcation exposure. These teeth aren't looking fantastic, but some of them aren't wobbly yet. I mean, where's your line in terms of ones that you would suggest waking them up and referring
So,
to try and save teeth, or does that make sense?
so from a kind of a preservation point of view, I mean, I would always try and want to preserve kind of what I would class as the major teeth. So your canines, your maxillary fourth premolars, your mandibular first molars. They're kind of your big structural, long roots, massive teeth, really. And they're the teeth that your animal uses a lot. So they're the ones we want to try and save. If we're seeing furcation exposure, so if you can get your probe into that furcation, then we're looking at kind of a grade 3 to grade 4 periodontal disease. And at that point, the likelihood of saving those teeth with periodontal surgery and bone grafts and stuff like that is significantly lower. And so I would say if you have furcation exposure, if the owner is super dedicated and keen to go for referral, then feel free to refer, but the likelihood is long run, that tooth probably isn't hugely savable. If we're seeing you're seeing a bit of recession and on your x-rays, you're seeing a little bit of bone loss, kind of up to 25% bone loss, for example, then potentially those are savable teeth. And that can involve either closed root planing, so having a small instrument going into that pocket and debriding out all the crud and bits that are in there, all that inflamed periodontium to kind of help it regenerate, or even going down the more advanced route of raising a flap, removing all that dead material, and then laying down a bone graft and a matrix to try and help regrow things. And that can work really well. The caveat to kind of trying to save teeth in that fashion, though, is you need an owner that's dedicated. You need an owner that is going to commit to brushing that dog's teeth every day. You need an owner that is going to come back in 3 months for repeat x-rays to assess how things are changing and improving. And if we're not going to get that improvement, or you're not going to get that kind of commitment, then it's likely that that tooth isn't fated to stay for long. I would always
Yeah.
want to give teeth a try, give them a chance, but sometimes that chance isn't as good as other teeth.